I forgot that I was going to do this in Spanish. Can you see my screen now?
Sí.
Okay, well, thank you. Today, we are happy to talk to you about the COLCH organization and the Foodshed small farm distro, our projects um, through food as medicine. And my partners, Maribel and Delfina, are going to start. And they're going to tell us what Colch is. So I'm going to let them take it away first. Well, good afternoon, everyone, and welcome. To hear about our program, Food as Medicine. I would like to thank Foodshed for inviting us to be a part of this presentation, and because they're always enhancing the group of the value of the community groups. My name is Delfina Alvarez, and I am part of the the organizing Latino committee in Colch. And I'm going to share a little bit about us. Well, our mission is to prevent obesity and diabetes in children. We want to empower families to adopt a fulfilling lifestyle, combating chronic childhood diseases through education, community support, and comprehensive health. Our vision is to strengthen culture of prevention in which every family possesses the knowledge and means to live a healthy life, eliminating the barriers that hinder the full physical and emotional development of children. These are 12 people who are members of Colch. All of them are women from our community, highly committed in our community, and we all started supporting in our children's schools through different committees. Who are we? COLCH is a community organization founded in 2014 by Latina immigrant mothers. The mission of informing and empowering the community regarding the rights to quality education and health care. Colch has built networks comprising over 600 families by offering culturally inclusive workshops on nutrition, health, and educational literacy. Here are some pictures from some of our workshops. Well, during its first 5 years, we conducted informational workshops with specialists in general health, nutrition, mental health, and education. Additionally, we organized resource fairs and events featuring mobile clinics. In 2019, Colts embarked on a strategic transformation and defined a clearer vision driven by the invaluable support of Ms. Blanca Melendres, director of the UCSD Center for Community Health. She has been a key piece to strengthen the community voice and promoting the work that volunteers do. We have, thanks to her, been a part of important um, programs within our community. Her leadership has been fundamental for our organization. Next, please. Thank you. Well, our institutional partners, UCSD as well as COI, have been an important part of us. Woodshed, we are now working with the Ohio University with different research. I want to say that we are based at City Heights, a zone with issues, but we are a city that is a multicultural city, so we have to face different challenges. Our community partners are, as you can see, a lot. All of these that are listed here have supported us one way or another, and they have all been a key part to developing our programs. COLCH also serves as a bridge between community residents and institutional partners to ensure that public policies, advocacy, and research efforts are aligned with the community's needs, strengths, and assets. We, as a community group, have helped mm, many people to be a part of social programs, and we also fight for what we think our communities needs. We supported after the pandemic, the PBT program, so that people could use this benefit given by the government without fear. All of these programs have been conducted during 2020, and we have been a part of different partnerships. We have also been a part of development and approval of vaccines, as well as using information about COVID on a language that our community could understand. I also want to highlight that during 2021, these are the different organizations that we have worked with. And next slide. Moni, please. I would like to highlight now that we've been working, and you can see it in our next slides, but I would like to highlight that we are currently working with Más Fresco Plus registration for the pilot program for individuals who do not qualify for CalFresh and seniors with chronic illnesses. I think this has led to our collaboration with Foodshed, and after the pandemic, we faced different challenges as community groups. And as I was saying, we are a group of Latina mothers who are worried about our children's education. And after the pandemic, the we didn't know how um, the lockdown would affect us. So we had to innovate. So Coach transformed its community work. So we shifted from conducting informational workshops to developing our own programs for children and mothers, which allowed for us to work directly with the community. Now, Maribel is going to share a little bit about the two programs that we have created as a community group. Good afternoon. As we all know, during the pandemic, there was a lot of anxiety, stress, and depression. And that's when we came up with the idea of raising champion children. This was a 3-week summer camp designed to help children and their families get active together. We focused on physical activity, healthy eating, and mental health, providing practical tools that they could continue using at home. Building bonds with healthy moms. In order to create this program, one of the challenges that we had to face as a community group was getting funds from different organizations or institutions from the government. So we became a 501c3 organization in order to get funds for our programs. Building bonds with healthy moms. It was a 3-week summer camp designed to help children and their families get active together. And we know that taking care of ourselves has to come first in order to be able to help our children. And we have to set an example through our actions. Healthy Moms Champion Kids. Following the same format as Raising Champion Children, we focus on 3 key pillars: exercise, nutrition, and mental health. We have identified 4 factors through these programs. We have identified different challenges that our communities are facing, but we have also identified some positive impacts. Families feel more motivated to make healthy changes when they have the support and companionship of other families within their community. Child participation. When children actively collaborate in food preparation, they show greater openness to trying vegetables and greens that they previously rejected. Family bond. Children experience great joy when seeing their parents participate in the same activities as them, which strengthens the emotional connection. Sense of belonging. The fact that people from the same community lead these programs makes families feel welcome, understood, and safe to participate. These are some of the challenges that families in our community face. It is difficult to find organic foods in our neighborhoods. Economic barriers limit our access. A lack of information or an overload of information on social media leaves us unsure of what to eat. There is a lack of educational and awareness regarding what we consume. Some people have limited cooking experience or skills or are unfamiliar with the ingredients available. A fast paced lifestyle does not lend itself to cooking at home. The alliance that we have created with Foodshed started in 2021, coinciding with their arrival in City Heights and their collaboration with UCSD's Más Fresco Plus program. Upon learning about their vision regarding support for local farmers, sustainability, and conscious nutrition, we discovered a complete alignment with the changes we seek for our community. It should has served as a fundamental pillar, providing local produce to our families and openings its space for culinary demonstrations led by community health promoters. This relationship has driven a personal and professional transformation among the members of COLCH who have received training in food security and food handling. Okay, now I'm going to ask Monica to continue with the presentation. Thank you so much, Delfina and Maribel. I was very happy to hear about Colch's history and background. I'm going to share a little bit about Foodshed. Those of you who are not familiar with us, but I am very happy to see very familiar faces here in this call. Again, my name is Monica Lin, and I am the coordinator for Food as Medicine as part of Foodshed Co-op. Um, farm, Farmers and employees are owners and make decisions regarding the food system they operate. Our priorities are regenerative and self-sustaining farms and the fair distribution of their produce, which had started in March 2020 during the pandemic. And it is difficult to forget that when the global chain of food was completely stopped, we suffered a lot of food insecurity as well as anxiety, just as Maribel and Delfina have already mentioned. And a lot of the markets were closed, and the local growers were losing incomes. So five farmers joined forces to offer bags of their harvest, which were distributed on a pay-what-you-can basis with five different items that were given to needed families in City Heights within the pandemic with the help of health promoters so that we could identify the most affected families. We also have a weekly market that's open to the public where we offer that discount table, and we also sell subscriptions for to farm bucks so that we can pay the local growers and as well as sustaining our projects. Now, this is a package with different fruits and vegetables that is delivered to your home once a week, and it is the strongest way to support local growers. Those bags are given to families to their home from our department at the San Diego Food Hub. These are the different branches of our hub, the Farmer Resource Hub, and these get directly to the consumer and also to different institutions such as public schools, and local growers get a fair pay for their products. And we have a farmer resource hub, which is a resource hub for our local growers. At the farmer resource hub, we have programs for um, our local growers, and we them different workshops so that they can continue producing their products and facing in a better way the different plagues as well as climate change. Now systems change. Our team here makes sure that while the grower gets a full price for their products get to those who most need it. And they work with community organizations as well as with the San Diego County to fight against climate change. Within the San Diego County, we have over 5,000 farms, 70% of which are small farms, which had started out with 5, and now we have 60 small-scale farmers that are committed to regenerative and sustainable agriculture and to the equitable distribution of their harvests. As we all know, um, a lot of farmers are motivated by income, and a lot of times the agricultural workers work under difficult conditions. Through this system, we produce high quality fruits and vegetables while giving better conditions to the farmers and their workers. Now, nearly 400,000 people in San Diego suffer from food insecurity. Now, these are the different ways through Foodshed has been able to reduce barriers while we continue paying the farmers a fair price. These are our discount tables. We accept CalFresh, and for our subscriptions, we provide our products to the different food banks, such as Feeding San Diego, San Diego Food Bank, and to public schools, and free food programs using subsides partnering with community organizations and health clinics as well as through Más Fresco Plus. For those of you who were in last call's meeting with Dr. Chen, you heard a little bit about food as medicine, but I'm going to give you a little summary. Food as medicine is, well, there is a connection between a lack of a good quality diet. I'm sorry. Studies show that most of the chronic illnesses that we suffer are due to low quality food. So, low income communities are more vulnerable to illnesses caused by nutrition insecurities. So, this is a national initiative through which low income families can have access to high quality food through their um, their health provider. Now, they have their health provider have been a part of this program in order to prevent some of these chronic diseases or illnesses. This is something that's been happening to our country, and each state and each county are fighting this in a different way. In San Diego, there are some programs that are given through the medical insurances, but none of them offer local food. And we know that local food, which is produced with regenerative practices, is a more high quality food. So when we talk about food as medicine, we want the highest possible nutritional food. So, how were the relationships with the clinics formed? How did the farmers start working with these health institutions? Now, UC San Diego Center for Community Health, family health centers have created roots with local farmers when they helped establishing the City Heights Farmers Market in back in 2008. There are videos in YouTube where Blanca is talking about this farmers market. Therefore, this opened the doors to the partnership with their Mas Fresco program to the local growers. Now, these led us to working to the Family Health Centers of San Diego, and they had been working on a program of fruits and vegetables. And then Foodshed was able to work with other community clinics. But at community clinics, patients do not have a lot of time with their um, physician in order to receive a more complete healthcare. So we needed a more holistic approach to treating these patients. So the doctors from these clinics were already participating at the local food economy and supported personally all of the local farmers. So they knew that they wanted to offer this high quality service to their patients. That's why they decided to work with Foodshed, and we have two types of programs. The first one where we partner with UCSD, Family Health Centers, and it's the produce prescription, and where the clinic identifies and refers patients with chronic health conditions, and they receive a bag every 2 weeks with 8 seasonal items for a year. Participants have access to educational resources and treatment for chronic conditions through their clinic. At the end of the program, the clinic will report changes in the following health indicators, such as hemoglobin, A1C, blood lipids, and blood pressure. Our next program is a pilot food pharmacy. Um, Here we are partnering with Family Health Centers and Mid City Community Clinic, which is across the street from our food pharmacy. The clinic also identifies and refers their patients with chronic health conditions, and different from the first program. This program gives weekly credits to their patients so that they can buy at their local fruits and vegetables at the Foodshed market. These are credits of $24 for 20 weeks. And I'm also going to talk to you a little bit more about food as medicine cooking demos. The clinics will report changes in the following health indicators. Uh, Different from the first program where participants get their product right at their home, a lot of times they don't know where their food is coming from. Now, the participants in food pharmacy can select the food that they want to eat. And in this way, the patients are active participants of the local economy that supports their food system. And this is all a part of our program. Now, these are, even though we recognize that 20 weeks are not a long time to see a big difference, we think that during this period, we can see that the patients can create better and healthier food habits that they can sustain over time, and to diversify their diet. And we hope that they continue strengthening healthy eating habits that they have learned during the demonstrations, and that they can observe improvements in their health, and that they can identify a resource in their community where they can access local healthy produce within their community. Through this pilot program, good relationships with the clinic are promoted in order to open more doors to more opportunities like this. Real food sovereignty, we need not only to support the local farmer, but we also need to empower the consumers. So, how do these pilots get to this? Well, they do it through the demos, the food as medicine cooking demos. The doctors provide us with healthy recipes, and we use seasonal produce from the Foodshed market. And COLCH assists with food preparation and cooking. We also invite a local grower to join us as a special guest to share about regenerate, regenerative regenerative and the food system. And Coach also participates in the interactive sessions with the doctors to emphasize the importance of consuming fruits and vegetables. This is a safe and welcoming space where people can ask questions, receive nutritional information, and learn cooking techniques. What makes Colch successful at engaging the community? Well, they face the same challenges with their families. So people in the community relate to them. They closely understand the needs and experiences of the community, and they have years of training and capacity building. And as you can see, Coach has been there way before Foodshed, and they have a lot of experience. And after joining our efforts, their trainings on food uh, has been more has been better, and they have been able to support their community in better ways. And I would like to also mention that these pictures are pictures from our cooking demos. And the first picture we have on the back, one of our local farmers, one of our doctors from the family health centers, and the rest of the people are just participants within the program. Now, in the other picture, we see women from Colch in one of the trainings at Foodshed, where they also learned more about the local farmers. So, when healthcare is community-led and take place within the patient's community, gets the next things: comprehensive, holistic, and person-centered care. The individual becomes integrated into a community support network, and it strengthens community resources and tools and infrastructure within the community itself. So we invite you to take action, to be a champion, just as our doctors that have decided to work with us. And if you identify yourself with anything that I have shared with you today, and if you are a part of an organization or if you're a part of the medical sector, we invite you to give your all, invest in community organizations like COLCH and Foodshed, and follow the lead of community organizations that have already done the work and know their community best. And also, I would like to invite you to connect with Colch if you are interested in offering Buddhist medicine demonstrations for your organization. And this is for everybody. We can all share the Buddhist medicine message within our family, friends, and community so that it becomes the norm. And there are more food as medicine programs and more food pharmacies. And we cordially invite you to visit the Food Shed Market and continue supporting local farmers. Here is more information about the community market. Please a picture in, and that's all on my part. Thank you. Now I'm going to give it back to Gabriel. Very well done. Thank you for sharing your work with us. I see through the chat that there was a question from Aini, and she was asking how partnership came about with the Ohio University. I don't know if you could share a little bit more about that partnership. Well, the Ohio University, well, we met Dr. Maribel Gonzalez. She used to work at UCSD San Diego, and she had the opportunity to work well, she's currently working at the Ohio State University. So she invited us to be a part of research for our young community in City Heights, and that's how we created the connection. We would also like to highlight that she is um, currently in Ohio, and she gave that presentation. And in Ohio, they were very interested on seeing how we handle the community groups here, because she was saying that in Ohio it's more difficult to find support groups to promote anything. So we've been working with her, and she supported us throughout the second part of our program with healthy moms. And we are trying to see how much impact this program is having in the community. So we want to see if mothers are um, caring for themselves. But that was basically the connection. Thank you, Delfina. Thank you. And well, I would also like to highlight the work that we are doing, Foodshed together with COLCH. I think that low-income communities are a challenge. It is a challenge to create healthier changes. If you could, y- you know what City Heights is, you would know that City Heights is full of fast food places. We have very few places where people can practice sports or do any physical activity. So this collaboration between Foodshed and Colch has been great, and we've been doing a lot. They work with seasonal products, and we were so used to finding mango or a peach in the winter. We have lost that connection with the seasonal production. So uh, the support from our local farmers is really important in order to create awareness so that people try to buy seasonal products, which are the ones that are the best for consumption during a specific season. And um, doctors have been very motivated by the participation in our community. And I always give the example of kale. I am Mexican. I have never tried that vegetable. It is a weird vegetable. It's green, but it's kind of rough, and we don't really cook with it. But now that we have had the opportunity to get to know this vegetable and its nutritional value, we have started making it a part of our food prep. Now, patients who get here are people that are 40, 50, 60 years of age, and sometimes it is difficult to get them to start eating more vegetables. It is a challenge. We have to take baby steps little by little so that they can get used to these new different foods. So we invite all of you who are at a different power positions. We invite you to support us so that we can have more resources so that the community volunteers can use them, because the connection that we make with the great institutions or the great corporations is important, because if we do not create this link between the community and these organizations, then we would be lost. Community trusts us because they see that we face the same challenges. And I think that's the connection that we have been able to create, because we let them know you're not alone. We face the same challenges you face. We we also struggle trying to create new habits. And in our community, some people believe that you eat vegetables because you are poor and you cannot afford processed food, but that's not really true. And the fast food industry has taken over a lot of our communities because it's more practical. It takes less time, but we would like to you support from you so that we can give or bring more resources to our community. Uh, Very strong thoughts, Delfina. Thank you so much. And thank you for sharing the all of the learning that you've done throughout your community. I have one more question, and it is for Food Shop. Thank you, Gabriel. How or what is um, a local equitable? This would be having access to high quality products so that everyone could have uh, a fulfilling life. I think that when we talk about this, we also refer to the resources that farmers receive. I have always, no, I always think about the different subsides that industrial farmers get, that the money that the government pays them in order to produce them genetically modified products, which is really what's causing having more access to processed food than to healthier foods. So, so equitability for me begins from the top down, when the resources are being shared from the very top, they should be focusing more on supporting farmers that are producing healthy products. And that's kind of a chain so that people can have better access or more access to these healthy foods. Thank you, Monica, and thank you, Maribel and Delfina. You have given us a lot to think about and how to think about how to move so that we can support all of this work. Any other questions or comments? If not, we thank you all for your time and the presentation.